A very good evening, dear viewers. Like I always love to say, the lights are on and Purpose Rwanda television show is live on KC2 from the heart of Kigali in Rwanda. My name is William Evans and welcome to this tonight's episode. Today we are going to talk about a very sensitive but key topic, and maybe I need to welcome you to the month of mental health awareness, October. And with me today we are going to be talking about mental health issues at our workplaces. And with me to discuss this is Dr. Jean Damascene Iyamuremye from RBC. Most welcome, sir.
Yeah, thank you.
Yes, you could introduce yourself to that.
Yes, I'm, as you said, I'm Dr. Jean Damascene Iyamuremye from RBC in the mental health division, where I'm working as the director of psychiatric care and mental health treatment. So I'm glad to be here to discuss with you, as you said, this very sensitive issue of mental health, especially at the workplace.
Well, a pleasure to always have you, sir. To begin with, according to World Health Organization report 2021, statistics show that about 1,000 young people aged from 18 to 25 or 28 commit suicide every year in Rwanda. How bad is the crisis? How bad is the situation currently? When we talk about mental health issues, how bad is it?
Yes, suicide, especially in young population, is a big issue. Yes, for your information, every 40 seconds there is someone who is
committing suicide,
which is very distressing issue. So we need to take some action to stop or to reduce that those numbers.
Every 40 seconds, a person commits suicide because of mental health issues.
Yes.
That is quite a very big number. It is very worrying.
It is a very big number, and even in Rwanda, we have noticed that the suicide are being increased according to the number of people who attempt suicide received on our health facilities. It is like there is a growing trend of people wanting to commit suicide or attempting it, and even those who succeed, if I can say that, succeed suicide. Yes, that is.
So, Doctor, I want to understand from where you stand as RBC, how prevalent are mental health issues at workplaces, and what are some of the factors that could be causing or contributing to this challenge?
Yeah, let me say that there was no really a study which was in Rwanda exploring that issue at workplace. But from our survey that was published in 2018, in general population, 20% of people are living with mental disorder. If we say general population, obviously those who are at workplace are among that general population. But from our data analysis, from some small exploration, we have found that more than 25% of people at workplace express distress express mental health issues. Unfortunately, those who are showing signs and the symptoms of having mental disorder do not disclose easily to either to the employer or do not take action to go to seek help because of stigma of people who are showing that they have mental disorders.
Okay, so doctor, from the survey that you mentioned in 2018, 20% of the general population
Yes.
deals or are struggling with mental health disorders,
Yes.
and 25% of
Yes.
25% of the general people is
From
happening from workplaces.
Yes, from this the general people, but from those who are employed.
Yes.
They are from that survey. Those who are employed, 25%. If you take a sample from that, those who are employed, 25%.
So 25% of people that are employed in this country
yes,
are suffering, are dealing
yes,
with mental health
with
disorders.
different mental issues.
Okay,
Yes.
so doctor, I want to understand what exactly is causing this issue. What are some of the factors that are causing this issue
Yes,
at workplaces?
from this data maybe said that mental health is when someone is psychologically well-being, which is evidenced by emotional stability and having a stable relationship, and someone who can cope with the normal stress of life, and also can work productively and effectively, and to contribute to the society. If I said mental issue, there is a small which can say mild, moderate, and severe.
And severe.
And yes, we took all those categories, moderate and severe, when we were exploring those things at the workplace. And the contribution
Yes.
is that we mean what we call stress.
Yes.
Meaning the demand of the work is not equivalent of what the resources that are allocated to the employees.
To do the work.
That is what
Causes
causes stress, and the one of the factors that make people to be sick is stress.
Okay, so
And
doctor, maybe
most
someone...
of the time, the employer report stress at work. That is maybe why they are becoming more increasingly the more reporting mental issues.
Okay, so doctor, maybe from a professional point of view, there is something that is called normal stress.
Yes,
maybe
of course.
we need to understand what is normal stress and when does stress become not normal. Are there degrees?
Let's say life is stress.
Yes.
And we need normal stress in order to work. For example, you need to wake up and to go to work. You need also a deadline to meet your assignment, and but that is more and normal pressure are needed. But if the pressure become chronic and it become too much, and that is when we said it is a stress, it is abnormal stress. For example, if you have too much work, one person working in a place of 2 or 3 person, and if you are working in an environment where you are not having proper or adequate equipment,
to
and
deliver.
we are required to do your assignment, and it becomes very stressing if you don't have adequate equipment. Also, if you are working in an environment which is not healthy, it can make you bad, and it can generate stress. For example, if you are working in an environment where there is too much noise, when you need concentration, you can experience stress, obviously.
Okay, so it's very true that given the times and the economy, statistics are very high unemployment levels, life is very expensive. And so very many people have come up to try other things. So you find someone that is multitasking, they have like several jobs, they are doing gigs here and there. Are you saying that multitasking or having several tasks on your desk is actually among the things that could be getting you overstressed, overly stressed, or abnormally stressed, and that could result into a mental health disorder?
Yes, you mentioned to have a multiple task
Yes.
in order to have more money.
You
or
must
more
make
resources.
ends meet.
That is where I said, if you don't have enough resources, among resources is it to be well paid, and employers should know that they can give the equipment, but also they can pay the salary which is equivalent to what they are requesting the employees to provide.
Okay, so employers should raise the pay of their workers.
I'm not saying they should raise. They should consider.
What should they do
if the salary that they had they give to the employer
Is enough?
equivalent
to what I do?
Equivalent to what they are requesting to the employer.
Okay, so going back to the figures of 25%, it's actually a very big figure, and it is happening in our workplaces. What are some of the initiatives, effective initiatives and strategies that companies and employers should put in place at their workplaces to encounter, to sort mental health issues and disorders from in their employees?
You know, we are celebrating mental health
Yes.
every year, and this year it said the mental health is a universal human right.
Yes.
Yes, and we said mental health is part of health, and in this year, in collaboration with the Minister of Health and Minister of Labor,
Yes.
we launched what we called the workplace wellness program.
Yes.
This is one of the strategy that will help to promote or to improve the mental health of employee, even employers, and they work. That is one of the strategy. In this program,
Yes.
we want to reinforce what already have put in place. You know, even the Minister of Labor have published the ministerial order which required all institution to put a committee related to safety and health at the workplace. It means that committee should be responsible of exploring if people they are having health condition and they are in security at the workplace. Meaning even mental health is
inclusive, it's part of
the package.
Yes, you know, Doctor, when you say that mental health well-being is a universal human right and
yes,
every employee deserves it, even the employers actually deserve this right. I want to understand from where you sit, is there a legal framework in case someone abuses this right, this fundamental right of his employees, or in case they, well, people, if your employer, for example, does not, you know, there are no strategies, there are no initiatives to ensure that there is that wellness at work, where do they go? Where do they report? If are there strategies? Is it legally binding?
Yeah, I think what you mentioned is provided in that ministerial order, where they started. I don't remember the article in that law. The obligation and the right of employee and the employer, and it is if they are also some article in that one which provides some obligation for institution, employee, and even supervisor, managers. So yes, it is there.
Okay, so Doctor, from still your desk as a professional, and that as someone that is in charge of mental health and well-being and the wellness of workers, and the campaigns that you're launching as RBC, I want to understand what is being done to address stigma, because you mentioned that it's very true that people get stressed and get overwhelmed by work, and they keep quiet. Some are dealing with very, very severe mental disorders, but they have no one to talk to. What are you doing as RBC, or from where you sit, and from the campaign that you're starting, the Workplace Wellness Program? What are you doing to address stigma?
Yeah, let a little bit talk about what we needed to understand what stigma is.
Yes.
Is that discrimination? Is discrimination of people who are showing that they are having mental issues?
That they need help.
But for stigma, we noticed that there is three kind of stigma as individual stigma, where the person is when he is not able to disclose himself and to express what they need because of stigma. They don't want to take action to seek help from within them. But also there is what we call social stigma from the society, where someone who was even hospitalized for mental disorder are not taken as a normal person who are able to contribute in the society. And then it increases that individual stigma. But also what we want, there is another one, like institutionalized stigma, where, for example, a staff who experience mental disorder, and if you go to health facilities, seek help, and even they don't recognize that they can have a leave, a healthy leave, as the other people having physical issue, you know, and some of them they found that they are fired for that, and that is very bad for people who are having mental disorder.
So, talking about stigma and individual stigma, social and institutionalized stigma, you notice that most of the workplaces occupied, most of the positions are occupied by elderly people, and very few. Is this, someone can hear mental health issues or disorders and probably think these are things for the old people because they are, you know, they've aged, they are doing a lot of tasks. So instead of forcing and doing all these things, why don't they resign and go back and, you know, take care of their farms? And, you know, is it an issue of age, or it cuts across all ages?
Take people as old and they go and take
so
care
that
of
the
their
fresh
farm.
blood can come in,
And
people that are very
yes,
energetic, that can
yeah,
multitask and deliver according to the, you know, to the visions of the company and organizations.
I don't know if the work itself
Yes.
promote health and mental health, because of you can feel you can do something. It is a part of characteristic factors that influence mental health. Having a work, having something, we are having a contribution to the society. It is also a part of the factors that influence, contribute to the good mental health. And if we can't say the fact that the effect of age
Yes.
can be one factor that we can say that that person can have mental disorders. For me, it is not scientifically approved. As long as the person express behavior which is adaptive of with the situation and the age. That is how I see
So
things.
the disorders cut across all ages.
Yes,
it's not specifically for
and
old
this
people.
time there are some disorder which are most prevalent in the young population, and the others are most prevalent in the old age. If we the issue is how to promote, how to protect mental health for everybody, young and old, and that is when it comes to the workplace.
Okay, so it's cutting across, so there is no age limit. It's not age exclusive. So, Doctor, I want to understand from a professional point of view, what should employers, what should organizations put in place to ensure that they support people that are already showing signs, but also for even those that are not showing signs, that they can encourage them to open up about mental health disorders if they're experiencing severe stress, if they are not, what should bosses do, what should employers do, what should organizations do to make sure that there is that relationship where an employee can open up about these issues at workplaces?
Yes, one thing we talked about it. One is to establish that health committee in a workplace, where the committee is elected by staff themselves, and then the other thing is to be open and to put in place work condition that are conducive for health, and especially for mental health. And for managers, they can interact, promote social connection, which is mostly helpful at the workplace.
Yes.
And not promote the individualism in the workplace. Promote social connection, and they let people express easily their feelings, and even the mental, the emotional feelings, and they make in place some strategy when someone is showing mental sign or the symptom, how to help them, and if they are feeling sick, and they are also help them to seek help, and the help are there, as I told you. In Rwanda we have professionals, and also we have services which can help people, anyone who is having mental issue.
Okay, so services are available for bosses and organizations that have their employees that are struggling with mental health issues and disorders. But probably the question could be, are these services, well, they are available, are they free, or at what cost?
Yes, there are health services, and as for any physical and any health services, even mental health, they are took into consideration. And when you, for example, you go to the public hospital, those services are covered by community health insurance, which is commonly called mutuelle de santé.
Okay, so doctor, as we come to a conclusion, mental health issues and disorders is a very serious topic, and it is happening. It is with us today. Those days, people would think it's a thing for the Western world, for whites and Europeans. It's not an African thing. It shows that there's a lot of ignorance. People have not yet understood what mental health issues are, what it is, the well-being. People think it's something that is not their business. So as we come to a close, what do you think? Where do you think is the missing link? What are we supposed to do that we are not doing, that causes people not to know about these things in our organizations and in our workplaces?
We like to say there is no health without mental health. And people, they should know that mental health should be considered equivalent to be considered as physical health. But most of the time, mental health is left behind, and we focus only on physical health.
Yes.
It is a time to say that mental health should also be considered as a physical health. and especially for at the workplace where we are requesting workers to produce. If they don't have mental health,
Yes.
good mental health, obviously even the productivity will be impacted, and that is why we call upon to those employers to consider that as long as the health of employee are neglected, is neglected, obviously the productivity of the organization will not be healthy. If I say it, let us consider the mental health at the same as physical health, and help people who are expressing mental issues, and if it is if you can't help at workplace, call or refer the person to the nearest health facility. That is one. And also for employees, they should do regular check if the condition that are made in place are conducive for mental health, in order to promote health in general.
Okay, so as RBC, you have a very interesting slogan that says "Healthy people and a wealthy nation." Are there opportunities for organizations and employers to train their workers about to create this awareness? Do you have opportunities for organizations, and how do they come to you? And also, as in your parting shot, what is your commitment as RBC?
From that law on occupational health, the law is on occupational health.
Yes.
Every employee has the obligation to train the employee to motivate them to protect the mental health. But as the RBC and the Ministry of Health, also our main objective is to have health people. So we also sometimes we organize some activity for awareness, either in the general population or in a specific place as a workplace. And that is what and also we provide the help when people they are sick, through health facility especially, but also we as we did last time in the car-free day.
Yes.
We also give opportunity for screening to see if people they are not at risk of developing any disorder, non-communicable and communicable disease, including mental issues.
All
so
right.
we can do that.
Yes.
And we are committed as we do to help anybody who is in need.
All right, Doctor, very many thanks for joining us today and for sharing your wisdom and knowledge about mental health. We hope to see you some other time when we call on you. So a very good conversation here with Dr. Mental health issues are serious issues, and they're affecting us. They are within our workplaces, and it's up to us to make sure that we address these issues. My name is William Evans, and this is the Purpose Rwanda TV show. Have a good night.